Hello, everybody. My name is Dr. Shadi Ireifej. I'm a board-certified veterinary surgeon and the owner of a telemedicine company called VetTriage. I also am the chief medical officer at a brand new clinic that's run by a rescue organization called Hearts Alive Village Animal Clinic. So thank you so much for having me. I want to thank the National Association for Black Veterinarians as well for hosting this. It's just absolutely fantastic opportunity. I'm in line with your goals, and I think we're going to make some big changes to add to the changes you've already done over the past few years. So thank you so much for having me. When I was creating this lecture, I was thinking about sort of what the goal is. We're seeing a lot more telemedicine lectures out there now, obviously with the onset of the pandemic. My goal here is going to be a little bit different. We're going to go over some basic concepts, but what I ended up concluding was that I kind of want to leave the lecture actually having more questions than answers, because I think we all know that veterinary medicine in general can be quite antiquated in the way that we do things. Everything from starting new medications to even social movements to something like telemedicine that's been used on the human side for quite a while. So I think that we're going to go over the facts. I'm going to insert my own opinions, having been exclusively a televeterinarian now for the better half of 9 months, and kind of instill sort of what I think as we go along with the facts here. So hopefully this will enlighten you as to what the current facts are, but also kind of give you some thoughts for future changes that we're hoping to implement here. So this is our outline. We're going to first define what telehealth is, go over some current legislation thereafter. We'll spend a fair amount of time on that. We'll talk about the different types of telehealth that's out there, give you some examples of companies that already exist. There's a large number of companies that exist, as you probably are well aware of. Obviously, I have to, of course, disclose my company is VetTriage. Not only do I utilize veterinary telemedicine and the day-to-day for my veterinary medicine career, but I also own the company. So we're going to talk about VetTriage, which I believe, of course, maybe biased, that it's the gold standard for veterinary telemedicine as we see it, and I'll explain why that is. Trying to be, of course, as neutral as possible. We'll go over some medical literature, future goals, and then if anybody has any questions, comments, or ideas, more than happy. This is definitely an evolution here. So we're all aware of the AVMA as being a very prominent voice in the veterinary profession. They're not necessarily a legal body, but we listen to them. They govern a lot of what we do. And so if you were to visit this website, the AVMA site, they go over the different types of veterinary telehealth. And this is already where veterinarians get lost, because we use the word telemedicine all the time and we kind of have a sort of vague concept of what that is. This picture is really nice in explaining it, although I will, of course, argue that there can be modifications here. But if you look at the veterinarian as being the central source, you've got what you think of as telemedicine there, which is the relationship that you have with your client and setting up the veterinary client-patient relationship, the VCPR. That's kind of what I think all of us think about. We do have the teleconsulting, which we use a lot whenever you use a board-certified radiologist or a cardiologist or to review diagnostics. That's telemedicine, at least a form of it. And then you've got prescriptions down below there, telemonitoring in the bottom right, and then the telecommunication, telesupervision. These are all defined, and we're going to go over each definition here. I'm also going to focus mostly on the teletriage portion of it that does not involve the VCPR, but the AVMA has done a nice job as far as outlining this, and telehealth is the overarching term. Telehealth includes all of this, and these are all subsets or categories of telehealth. So when we talk about telemedicine in the general public, really, even though that word's been popularized, we're talking about telehealth as the overarching term, and it includes all of these subdivisions. So what is telehealth? Veterinary healthcare services public health. It is using telecommunication technologies to facilitate assessment, diagnosis, consulting, treatment, education, care management, self-management. It's basically where the client or the patient is located at an originating site and the provider is at a distant site. And so this is pretty much encompasses all the categories that we're talking about. By the way, sprinkled in here are going to be some pictures of what VetTriage, my company, does on a 24-hour basis. So they'll have some pretty cool pictures. This, for example, is a woman whose dog got skunked, and so she's in the middle of bathing and while she's consulting with VetTriage. So it'll hopefully give you some insight as far as how can telemedicine be utilized in the capacity that my company does without really requiring, strictly speaking, a VCPR. We can still help people without being unethical, of course. So then we break down telehealth into telemedicine. Telemedicine involves animal health care services, medical information, one site to another via technology. It's consulting, treatment, care management. This is what we think of when we think about telehealth, but really telemedicine is a branch of telehealth. At this time, telemedicine is considered a tool of practice, not a separate discipline within the profession. And that's a major point that I'm hoping we can lobby for in the future as telemedicine becomes more widely used in our profession. I think that telemedicine actually should be its own pillar in the veterinary space. This is another example of a telemedicine consult that we had with a kitten that was unfortunately very ill. We actually sent this kitten to the nearest emergency clinic. So then going down the definitions, teleadvice. This is where things get a little tricky with definitions. So pay attention to this wording. Any health information, opinion, guidance, or recommendation concerning prudent future actions that are not specific to a particular patient's health, illness, or injury. So general advice that is not intended to diagnose, prognose, treat, correct, change, alleviate, prevent. So you're supposed to give advice to a client without actually altering the future course of that pet. It's a little bit weird. It's a little weird. And of course, that's my opinion. Obviously, I'm advocating for a use of telemedicine beyond what we currently are doing. I think it has way more prominence in our field than we give it credit for. And I want to compare it to the human side. So this definition by itself is kind of odd. How does one give advice to a client, to a pet owner, to an animal owner without being able to change the course of the future of that pet? It gets a little bit strange with the definitions, but these have come from the AVMA website. Teletriage, and that's where VetTriage falls under. Safe, appropriate, timely assessment and management. You're deciding whether or not you have to refer the case to a veterinarian or not. You're going over history and clinical signs. You might use some visuals, which of course VetTriage uses a full-on video platform. Diagnosis is not rendered. You make good and safe decisions as a veterinarian regarding the patient's disposition under conditions of uncertainty and urgency. And so this is where we safely live. This is where we view telemedicine as teletriage being an acceptable form of practice, if you want to call it practice, we're not really sure, and being able to help these pet owners out without crossing any legal or ethical boundaries. Then we break down the other definitions of telehealth. There's telepractice, professional services over geographic distances. They give examples in AVMA with teledentistry, telemedicine, telenursing. You've got teleconsulting, which a lot of us use anytime we discuss a case with a radiologist or a pathologist. Us, the general practitioners, are communicating with a specialist about the case. Telemonitoring, you're monitoring a patient that's not in the same location as a healthcare provider. So these are just further breakdowns. You wouldn't think that somebody would have a pet goldfish that they acquired from a fair 2 years prior, but there's VetTriage. We're trying to triage a goldfish. So we're going to now switch gears from defining what telehealth is and all its branches to the current legislation. And if you notice some similarities between the definitions, there's considerable overlap between between the definitions of each of these branches of telehealth. And so that creates some confusion. There's some gray areas there. So legislation, of course, is what we all try to ponder when we're talking about telehealth, because we want to know, what can we do? What can't we do? We don't want to get in trouble. We don't want to be unethical. We want to be able to serve our clients and their pets. So the veterinary client-patient relationship, we're going to go over in detail. We're going to talk about confidentiality, professionalism, follow-up and oversight as it relates to telehealth, prescriptions, medical records, cybersecurity, and there's way more that we're not going to be able to cover in the scope of this lecture. There's much more to think about. I want to reiterate, of course, that I'm going to be discussing these legislations and statutes and laws and regulations with some scrutiny. I am not an attorney. VetTriage has attorneys that backs up what we do, but I am in no way, shape, or form giving legal advice. I want to make that very clear. Probably self-evident, but I am going to instill my own opinions, though, as a veterinarian of 15 years and having been a televeterinarian now for 9 months, I'm going to talk about what I think now having had experience with just about 5,000 cases. So we all know that things are changing with COVID-19, and we don't know whether or not some of these changes are going to continue beyond the pandemic. I think that some of the states, like for example, California Veterinary Medical Board, I think they're starting to sort of convert and have some leniency as far as the VCPR and what that means, but we're going to see what the future holds. So of course, these regulations that are currently present are fluid, they're dynamic, they're going to change. They are up for interpretation, which is part of my gripe with the way things are defined currently. There's ways of defining certain words, and the details matter. And sometimes when you review the laws, and I've reviewed all 50 states, again, not being an attorney, but from my point of view as a veterinarian trying to promote telemedicine, I do notice that there's some confusion, even some self-contradictory information within the laws within a certain state. And we'll go over that in more detail. Here is a chicken with some gray lesion under its beak. We determined it to be an abscess and got them the help that they needed to take care of their pet chicken. So just another example of use for telemedicine. So I'm going to give you some examples for how things can get kind of blurry when you look at the laws under the context of telemedicine with respect to VCPR. They sometimes, not always, the state will define what a physical examination is, or they'll use just the word examination and not defining the physical portion. That matters. That matters, because is a video examination the same or the equivalent under the pretense of a telemedicine company or service? Is it its own thing, or is it an acceptable form of physical examination even though it's not truly physical? If you have the pet owner perform some attributes of a physical exam at home using telemedicine, does that count as a physical or not? And some states will actually say, when we say examination, we mean examination of any kind. Others will say a physical examination. You have to lay hands on the pet. That's interesting. There's variation state by state. How you see the patient is up to the veterinarian. So they want you to visualize the pet. Well, what does that mean? And states will actually admit to some degree that how you see the patient is up to the doctor. Use your own judgment. Other states are not so clear-cut with this. There's a difference between having a VCPR to perform telemedicine and a VCPR cannot be established via telemedicine. Those are two different things. And of course, we always assume that, well, you can't perform telemedicine on a patient for which you don't have a VCPR unless it's an emergency, which is underneath the teletriage category. But not every state specifies this. So these are just examples of situations where state by state, there's a lot of variability. And the location thing is interesting. So this is what we've noticed in doing and having VetTriage be a prominent telemedicine service in this space now. Location is funny because when you look at certain states, they'll either specify you need to be licensed in our state to perform any kind of medicine, whether it's telemedicine or your brick and mortar. You'll have others that say, well, we want the veterinarian and the client to be in the same state when you perform any kind of medicine, whether it's telemedicine or brick and mortar. So then I bring up questions. Does it matter where the veterinarian is licensed to perform telemedicine? Where is the actual veterinarian physically located at the time of the telemedicine session? If you're licensed in Texas, but you're currently in California and you're performing telemedicine for one of your clients who is in Texas, does that matter? Does that count? Where is the owner physically located? Where is the pet's physical location? We had a VetTriage session where a client who owns a pug, they're currently in Lebanon. The sister lives in Australia. The sister was calling VetTriage to get a second opinion on behalf of the dog in Lebanon. Where did that fall? I'm not licensed in Australia or Lebanon. The pet owner who's contacting me, they're not the pet owner, but yet they're paying for the services on behalf of a pet owner in Lebanon. So these raise some interesting questions. Who or where is the caretaker? So you have a dog sitter, the pet has an emergency. We're all familiar with this situation. Things only happen when the client and the primary pet owner is gone, they're out of town. They call VetTriage. Well, they're not the primary caretaker of that pet, but they're located in the state that the veterinarian is licensed in. Does that matter? Or you have a dog sitter at a location that's remote from where the primary client is located. Any combination of things you can think of, it's happened. We've seen it over the past 9 months with VetTriage. Temporary versus permanent residency. Is a client's location now their permanent residency or not? Does it matter? Do they have more than one home in a different state? Can you perform telemedicine across state lines in that situation? A lot of the states that I'm really happy with are the ones that say use your own judgment as a veterinarian. I like when they do that, because that seems to put the pet first. And I like that. That's obviously our entire goal here, is to make sure the pet is taken care of. But not every state does that. The majority don't. So in continuing the current legislation, the summary, as I see it, and of course, this is a really brief oversight on a deep dive that you can really have with these laws. You make a conclusion as a veterinarian based on multiple sources, on a federal level and a state level. And of course, at some point, to some degree, an ethical level too. What's right by the pet and by the client. So you take into account all these organizations. With regard to legislative issues, details are important. And that's where I really want to focus on the first couple of slides on definition of things. The definitions matter. The devil's in the details. We want to try and minimize interpretations and variations state by state. We want to make sure that when I read a legislation and you read a legislation, we have the same interpretation of it. It's got to be clear. So I'd love to have standardization on a state level, within organizations, and a federal level. I want to argue on the drawing here that veterinary telehealth should be a pillar. It should be the fourth pillar of veterinary medicine. You've got the GPs, you've got your emergency doctors, you've got your specialists. And most state laws will actually define where these three pillars stand in terms of the legal side of things. They've got different expectations, different standards. I think veterinary telehealth should have its own set of regulations. It shouldn't be just this kind of byproduct in a law that says, by the way, we recognize telemedicine exists. You can't do a bunch of stuff. You can do some things under these guidelines, and that's the end of it. I think that veterinary telehealth is here to stay. And I think that if we're going to do that, it needs to be expanded upon in the laws. And so I would like to think of telehealth as not only being the fourth pillar, but actually a way of bridging all these gaps. We're already doing it. We're already doing it. We've been doing it before the pandemic, and it's became more obvious that we need to do it beyond. So this is just kind of a list of the states that require a VCPR form telemedicine. Obviously, that's the majority of states that require it. There's actually a small number of states that don't require a VCPR to perform telemedicine. So now this is with an asterisk, because some states they're not clear as to where they stand, and you can kind of read that ambiguity in their laws. So I'm going to say this is what I've found in reviewing the laws. But with COVID, now the states are always posting new things, always new developments, and so it also depends on how you define their laws. So again, non-attorney, don't take this as a sort of a solid piece of information, but in doing my research for this lecture and beyond for setting up VetTriage, these states either make it somewhat clear or very clear that they don't require a VCPR when you perform veterinary telemedicine. And of course, if anybody listening to this lecture is from these states and knows differently, please let me know. So why such a strict guidelines on veterinary telemedicine or veterinary telehealth? It's a physical exam. It's critical because the patient can't speak for themselves, and the AVMA, as well as the majority of states that define this, mention that the client often misinterprets the symptoms that animal is displaying. And so because of that, you can't set up a VCPR without actually laying hands on the pet. Veterinary telemedicine can be used as a delivery of healthcare services only after a VCPR has been established. And without prior establishment of this relationship, a veterinarian is unable to provide the appropriate level of care and diagnosis needed to assist the animal patient effectively. I will, of course, wholeheartedly disagree with this, having been a televeterinarian for this long now. Physical exam is absolutely critical. I can have clients perform some portions of a physical exam via telemedicine. The client misinterpreting the symptoms. Anybody who's been performing veterinary medicine for a long enough period of time understands that probably 90% of your consult is listening to the owner. You pretty much have a diagnosis in mind, and the other 10% is you trying to prove it. That's the majority of cases, not every case, not every case, but there's fairly classic signs of a diabetic dog, of a renal failure cat, of a cruciate tear. So the physical exam, the history and the clinical signs of the client actually is fairly reliable. We rely on a fair amount to get the ball rolling as far as what we think is happening. You basically choose what diagnostics you want based on that. So I'm surprised with this statement. Now, of course, we all know clients that misinterpret vomiting and regurg, or a seizure and syncope. Fair enough, fair enough. My goal is not to replace the brick and mortar with telemedicine. We literally can't. But we should be giving more credence to what telemedicine can and can't do. And the last line here, without prior establishment of relationship, a veterinarian is unable to provide care and diagnosis. Again, I'm going to disagree. Hotspots look fairly characteristic. You can diagnose a hotspot on a video chat. It's not that difficult. Should you argue that's not the gold standard? Sure. Yeah, you'd like to actually perform skin testing on that patient. Of course, absolutely. But there are some things that we see with repetition here, and I believe this is somewhat insulting to the veterinarian, especially those who are seasoned, who see the same diseases over and over again. Again, these are all ideas I'm putting forth just to get us thinking. And by the way, this picture is a baby turkey. It has a septic joint of the tarsus or tibiotarsal joint, and this is the owner's way of performing physical therapy to help stretch out the ankle. And so they created this out of their CBD water box. So the AVMA has the Model Veterinary Practice Act that protects consumers and their pets by only allowing pets with an established VCPR to be treated via telemedicine, except in emergencies. An emergency situation will be determined by a review of a veterinary expert on a case-by-case basis, taking into account the animal's current health status and the incident that prompted the need for the immediate medical intervention via telemedicine. And so, of course, I agree. Absolutely. Telemedicine has a great space with the emergency side of things. So these two pictures, for example, you have two ocular diseases. On the one side, you have a boxer, and I don't know if you can see it on the video, but it has one of those persistent membranes, which, of course, not an emergency, but the pet owner thought there was a worm in the eye. And so they freaked out and thought, do I have to go to ER tonight or not? On the other side, you've got a German Shepherd, what looks like a bloody lesion, a bloody mass within the eye. Again, is this an emergency or not? Is my dog bleeding in the eye, or what's going on? This turned out to be a ciliary cyst adenoma or adenocarcinoma. We actually refer this to an ophthalmologist, and they had a workup done. So there are situations where the client is very thankful because they were going to go to ER, and which sometimes is, of course, needed, but other times not so much. So this is a nice example of that. Confidentiality is much stronger, it seems, on the human side, but of course, we want to make sure that we try to perform the gold standard. And so I do want to bring up questions of audio recording, video recording. Are there other individuals in the room when you're performing telemedicine? Does that matter? If you're performing telemedicine from your home office, does it matter that your husband or wife is there or the kids are there? Does that matter to confidentiality or not? We talk on the phone to clients at the hospital all the time, and there's people around us. Does that matter? It doesn't seem to. Well, with telemedicine, especially an exclusive company, a company that does telemedicine exclusively like VetTriage, where veterinarians can work anywhere they want, should that play a role or not? And then cybersecurity is a big one that a lot of us underutilize and underestimate. And we're going to visit cybersecurity, another slide here later. Follow-up and oversight. So the laws are pretty clear when they do mention it, that veterinary telemedicine, another reason why they don't want you performing it without a VCPR is because it requires follow-up. If you recommend a treatment or a piece of advice to a client, there is no follow-up with an exclusive telemedicine service. There's no way to have that happen. Obviously, we all know clients sometimes don't show up for the rechecks in the brick and mortar either, but they want to make it clear that if you're going to instill treatment to a patient, you should be responsible for the pros and cons of that treatment. And therefore, as a veterinarian, you need to be available for rechecks and oversight. So this relates to what constitutes as a VCPR, telemedicine rechecks. We talked about that. Audit session recordings. So this is interesting because if you have the ability, or if it becomes required at some point, that your medical record for telemedicine becomes an audio or video recording of the session, then what does that mean for records? And I don't know. I don't know the answer to that. And of course, we mentioned about being who's present during the sessions, who's present knowingly, meaning people behind the screen, and who's present but unknowingly to the client. Again, does that matter? Prescriptions is always a popular topic, obviously, and And so excluding the current pandemic, VCPR is required. And when you look at the different definitions, and I'm gonna go back to the initial slides regarding each branch of telehealth. One common factor to these definitions and the state-by-state laws and regulations is offering anything regarding prescriptions, advice, recommendations, et cetera, et cetera. Well, how come? So we know about the VCPR required for prescribing medications, fine. Extra labeled drugs, okay, fine. What about over the counter? How about nutraceuticals and supplements? I mean, clients are already going on Google and looking this stuff up and then purchasing said products. So can a veterinarian not be allowed to recommend Benadryl or glucosamine or a triple antibiotic ointment? They're not prescriptions, they're over the counter. Clients are purchasing those products anyway. Why can't they be advised or recommended under the guidance of a veterinarian performing telemedicine without a VCPR? Controlled substances are, of course, a no-brainer. There's reasons for that. Abuse. Diets. Is there a reason why a veterinarian can't perform telemedicine on a patient with no prior VCPR and recommend a weight loss program? Is that so harmful? General advice. Strict rest for a couple of weeks. Put an e-collar on that dog. Keep your pets separate because this might be infectious. NPO instructions. Can these things not be given out by a veterinarian through telehealth, telemedicine, without a VCPR? Seems a bit extreme. And so I really want the reason why I'm bringing this up is because I really want these laws and regulations to be very specific as far as what we can and cannot do. As of right now, they're not. The majority of laws don't really comment on how medical records, where medical records stand with telemedicine. However, when they do mention it, they say you should follow the standard protocols of your hospital, document everything. We can all agree to that. So standard regulations tend to apply. And other states don't mention this. What's the rule on this? If you're performing telemedicine, what are you supposed to do? So I'm going to go back to recordings. Does that play a role here or not for the future? When you have companies like VetTriage that are 100% telemedicine, does that matter? Transferring medical records. So this is kind of in line with confidentiality. We already transfer medical records. So if you're a GP and you're transferring a case to a surgeon or an internist, well, you're transferring medical records. Where does that fall? And then because we do it all the time, nobody objects to that. That seems pretty standard. We are doing it with the client's permission, maybe not officially so, but the client understands we're sending records. We are referring the case. Well, how come there isn't more watch over that? And then how does that fit into telemedicine? If we have telemedicine records, where does that play a role? Where do you send those records? Do you have to send them? Who has access to those records? And so electronic versus paper, there are plenty of veterinary hospitals still that have paper medical records, although the electronic medical records are becoming more and more popular. So does that matter? Does that play a role here? We'll see. The laws, other than mentioning for the most part how long you have to maintain medical records for, and that you actually have to have some kind of records, I want more dissection of this. Cybersecurity is huge. There are hospitals, and you may know of hospitals, or your hospital may have been a victim of cybersecurity attacks. It's definitely under-recognized, underutilized. And so I recommend anybody who's interested in learning more about cybersecurity, go to this website. It's a big deal. It's becoming a bigger deal as more hospitals convert over to electronic medical records, and as more hospitals go underneath the umbrella of a corporate entity and they're sharing things. It becomes an avenue for people who have bad intentions to go in and do some pretty bad things to try and make some money off you. So it's crazy how many veterinarians aren't aware that they need cybersecurity. I had no idea till I launched VetTriage. And so here are some examples of some pretty big hits from companies that have been victims of cybersecurity attacks. So just some examples. But I definitely urge you as a practice owner or manager to look into cybersecurity for your own hospital. It's a big deal. And again, where does it play a role with telehealth? So now we're going to switch gears over to telehealth types. There are three categories as I see it. In developing VetTriage over the past number of years and launching it, I've realized that there's different categories. And this sort of happened unknowingly. As a veterinarian, and VetTriage being a veterinary-owned company, I already knew sort of what clients expect. I knew what I want as a doctor for telemedicine, so I already went that route. But apparently, when you go over the actual research of it, you find out there's three categories. You have companies that offer software, you have companies that perform telehealth with non-video capabilities, and you have those that perform video. So the ones that offer software, these are companies that sell or lease their software to clinics so they can perform their own telemedicine. I don't know if veterinarians prefer to perform their own telemedicine or not. My initial gut feeling, and in talking to veterinarians, is nobody wants to perform telemedicine. They want to do the old-fashioned way, meet a client in the room, shake hands, and do your thing. So I put a question mark here because maybe that's changing. I don't know. But my sense still, after 9 months of doing this, that veterinarians don't want to perform telemedicine. They're not a fan of it. There are day-to-day barriers that make this concept a stressful experience for the client and the vet. Everything from scheduling to charging clients to recheck appointments to fitting in surgeries, things that require actual hands-on. It's difficult to instill telemedicine into your practice. This also does not alleviate the inherent challenges veterinarians face during normal and pandemic times. So we're still going to have booked appointments, double, triple, quadruple booked appointments. You're still going to have walk-in emergencies. You're going to have all the things we deal with on a daily basis. Where does telemedicine lie? Is it really a useful endeavor for a busy GP or a specialist or ER doctor to perform telemedicine, or should it be outsourced? Here are some examples of some information regarding telehealth companies that provide the software to you so you can perform your own telemedicine. And I want to highlight a few things. Obviously, these are not veterinarian-owned companies, so they have a different mindset to this. They may be animal lovers or tech people, but they don't have the knowledge of the culture that we veterinarians have. And so you can look into those into more detail if it's something that you're interested in. I'm sure the majority of you listening to this have already been approached by companies or have already signed on with companies to perform your own telemedicine. The second category of telemedicine and telehealth: texting, email, chatting. They utilize methods of discussion to troubleshoot problems with pets. There's no video involved with this. And if you look at the wording on their websites, they can be a little bit on the sketchy side as far as who's answering these calls. They'll use terms like veterinary professionals or experts or animal experts or pet experts. And so you wonder who's behind the scenes doing this. So it's an important detail. And a lot of these companies are also not going to be 24/7. So here's some examples of ones that don't really have any video involvement. They're text, phone, email. They have different guidelines, different prices. So some are direct to consumer, others are for the veterinarian to perform telemedicine outside their own clinic, or within your own clinic. Regardless, you don't require a facility to be associated with this. And again, there are plenty of companies out there, and ever since the launch of VetTriage, we've seen well, ever since the pandemic, we've seen a huge number of telemedicine companies come out, and we've had some copycats to VetTriage. Then we've got video. I do mention here we're the only one in this category. Not that other telehealth companies don't perform video. They do. But when you look at the entire landscape that we're trying to mold here to create a gold standard of veterinary telehealth, VetTriage is a standalone company. And again, I own it, so of course, yeah, I'm biased, sure, but I do want to make it clear that the idea behind this is to create a gold standard. I would like it that there were many different VetTriages, all performing the gold standard for telemedicine. I want there to be laws with this, regulations, standards. There should be. So we utilize proprietary video software. All the sessions are performed with a veterinarian who is United States based and licensed. It's 24/7. It's real time. It's two-way video telemedicine, on demand, no appointments. The cost is the same regardless of how many pets you bring to the table, what species, where you're located, what time of day, what the emergency is. And then we address all species with this. There are other companies that only want to perform this on dogs and cats, fair enough, but I think the future is going to be huge for other species. We're veterinary owned, 24/7, full video capabilities, personalized platforms, personalized protocols. This is for hospitals that want to utilize us as an after-hours answering service, which I'll go into more detail later on. Again, I want to specify that we're trying to expand veterinary telemedicine beyond what's already been thought of. We're trying to go beyond the typical telemedicine that everybody thinks of. We have a novel way of doing this. You need tech support. There's no, which we have 24/7, and there's no app or software downloads required. This is an example of just social media, my social media page, where we're trying to, of course, start a movement here with telemedicine. And so here I have a YouTube channel as well, if anybody's interested in that. VetTriage.com, $50 a session. You create an account quickly. The wait time is 4 minutes. And these are based on numbers that I calculated a few months ago, because we eventually are going to be publishing some data on this. Session duration, 8 minutes. And this is in line with other veterinarians who utilize telemedicine in their practice. They typically will find that between 8 and 10 minutes is needed to have a consultation in a brick and mortar utilizing telemedicine. So ours tend to be a little bit faster because our system is made for efficiency, and we're also performing teletriage, right? We're not talking about the long-term management of diabetes, right, on a 24/7 emergency line. We can, but typically we're not. It's teletriage. We then send a summary to the email. We then send a summary to the client via email, which also can be sent to a hospital as well if you're utilizing us for after-hours emergencies, or if you're a rescue organization utilizing us. We are finding that with an exclusively telemedicine company like VetTriage, about 20 to 30% of those cases actually require immediate referral to an emergency hospital. 70 to 80% require some home care, some observation, but go to your veterinarian when they're open again. And these numbers are pretty consistent. They haven't changed much over the past 9 months in looking into this. So this is interesting. And it is to kind of also support the hypothesis that telemedicine can be used to a degree without a VCPR that can help the pet and the client at a greater level than we are currently limiting based on the current legislation. 70 to 80% can wait for your veterinarian to be open again. It's pretty cool. And so that brings us then to how the uses are. Now, this is not unique to VetTriage, but there is no other company that does this. We know, we've done the research on it. So we are the only ones that do this, but I just want to give you an idea of the potential for telemedicine, because it's unbelievable. It's inspiring the veterinarian in 15 years to be rejuvenated when you start to find new sources for something like this. Direct to consumer is what everybody thinks about. There's a client, they have a problem with their pet, they utilize some telemedicine service to get help. That's fairly standard. Then we've got rescue and shelter organizations. These organizations, as we all know, anyone who's worked with these organizations before, you're well aware that their goal is to save as many pets as possible, but save money as well. We're finding out that we're saving these organizations that utilize VetTriage thousands of dollars by sending that case back to the referring veterinarian, the GP, the family vet, instead of going to the ER clinic that night. It's been a massive, massive boost to these organizations. And we're currently working with 4 different rescue organizations. That list is growing because they see the value in this. They get the foster who's taking care of that pet, or the newly adopted pet, or the pet that's actually in their care has some sort of a medical problem. They're not sure how severe is it. Can I wait for the veterinarian to open, or do I have to go to ER now? This has been huge. And we personalize these platforms so that the organization can actually purchase credits and just divvy out the credits to their fosters or to their volunteers whenever there's a pet emergency. So this has been revolutionary for them, and no one else uses telemedicine in this way. Clinic after hours answering service, I've already mentioned. For those out there, GPs who are either currently on call after hours, or have a veterinary technician on call, or utilize an answering machine or answering service, we all know that can pretty much be a huge burden on quality of life, professionally speaking. So what hospitals now have been doing, we've got a good number of facilities across the United States that utilize VetTriage in this capacity, is they'll place VetTriage on their answering machine and on their website. And they'll even hand out flyers to clients and say, if you have an after-hours emergency, either go to the nearest ER, and we're going to list the ERs, or go to VetTriage if you're not sure, and they'll triage you. This has been a huge boost for clinics. And the reason why is this. In line with your organization's goals in changing the culture, right? We want to increase diversity. We want to bring veterinary medicine to demographics that have not been allowed the opportunity to have that, We want to change the culture of veterinary medicine. This type of service has been instrumental. The new graduates don't want to do on-call. They don't. This promotes your hospital's ability to hire new graduates because they don't have to be on call. VetTriage takes care of it. We screen all the calls. We take care of it. You don't need to anymore. It increases revenue to your practice. Now you're not losing revenue to the ER or specialty hospital after hours for that torn toenail or that hot spot. It could have waited for you to diagnose it the next day or the next week. That limping dog could have waited. Instead, clients now can save money by using VetTriage, avoiding the ER hospital visit, and that is brought back to your clinic. So that you see an increased revenue. Not only that, we create an entire landing page for you and the flyers for you. So clients feel comfortable in using VetTriage because it's an extension of your hospital. Again, I hate to promote my own company, but there's no other company that does this. And I think this is just the very beginning of what telemedicine companies can do when you keep in mind what the culture of veterinary medicine is. So I believe we can increase hiring, we can improve the quality of life for veterinary staff, professionally speaking. We can increase your revenue. We can help clients get peace of mind, help save them money. And when they go to ER for an actual emergency, they know they had to go because a veterinarian was consulted with video chat. You have a T3 L3 myelopathy, you have to go now. You've got a GDV, you can't wait. You've got a blocked cat, you got to go. They show up to the ER hospital and they know what to expect. Then there's hospital triage and case allocation. For those of you who work at ER hospitals or specialty hospitals, you know there's between a 2 and 8 hour wait time. And I know that because clients who use VetTriage complain about it. We're trying to figure out a method, and some hospitals are already utilizing us to this capacity, where if they have a 4, 6, 8 hour wait time and they're doing curbside or whatever it is, and these wait times are specific for outpatient cases, non-critical outpatient cases, the client gets handed a VetTriage flyer or gets told about VetTriage. They sign on to our company or a company like us. I don't want to toot my own horn, but a company like us to find out, well, do I have to wait 6 hours or not? Is it worth the wait? I'll wait if it's worth it. And that hospital, that ER clinic is super busy. They are attending to their inpatients who are critical. Their staff is running around like crazy. We all know this. We all live this. Trying to take care of all these outpatients, trying to handle critical cases. The stress levels are through the roof. Medical records aren't being written up. It's been a disaster, and the pandemic has amplified that. So we want to say, utilize VetTriage. We'll delegate whether or not that case needs to stay with you and wait 6 hours or not. If it's a laceration, you should probably stay. It's a hot spot, you can probably go home and wait for your veterinarian to open the next day. We'll give you some general advice. So we're trying to figure out case allocation. And these are 4 categories that we have realized that a company like VetTriage can be involved with. And I think that the future of telemedicine looks incredibly bright when you look at all of these different uses. And again, all underneath still the category of teletriage. We're not doing anything that's beyond the current legal statutes or ethical issues. We launched early this year. We've got, well, at the time of writing this lecture, we had many less sessions. Any species category, we've had horses, hamsters, koi fish, reptiles. This is now the 3rd generation of our software. I have now, again, this is old. I have now about 150 veterinarians who are applying to work for VetTriage. And about 25 of those are specialists. Veterinarians want a better quality of life. They want telemedicine. Their clients want telemedicine. It's going to become a pillar, and we are trying to spearhead a movement. Our reviews are 100% positive. You can check on our Facebook page. Here's an example of our Instagram page. We have clients of all ages. You would think that the young clients are more likely to use telemedicine. We've had people from 60 to 90 years old utilize VetTriage. So it's fairly user-friendly. Clinics and hospitals are adopting telemedicine in general. They kind of have to with the pandemic, but with specific to VetTriage, we're seeing more and more veterinary hospitals reach out to us voluntarily and ask about our services because they're hearing good things. And of course, we've been utilized worldwide. Germany, Marshall Islands, Canada. So just an example of a flyer that we create for a hospital that wants to utilize us, promote us to their clients. It's got a blurb there about what we do, and then you can see there under number 1, that's the landing page. So you go to your own website, it'll lead you to the VetTriage and your own website, your own hospital's collaboration, so your client feels comfortable that we're not a scam. And then down the bottom, you see the VetTriage logo, but that little paw sign is actually the symbol, the logo of the community animal clinic that this is for. So we put your logo down there, and that way clients feel safe and knowing that they can go somewhere they can trust. And then this is a partnership page for those facilities that are utilizing us as an after-hours answering service or are using us for case allocation. Just a nice blurb to help train your staff, just so you know what you have going on. If you want to partner up with VetTriage, it's no cost to the facility to utilize us. Literally, it's a matter of just putting VetTriage on the website, give out flyers, put us in your voicemail, and you can feel relieved that your clients are getting peace of mind in the middle of the night, and it appears to be an extension of your facility, which it is. It's been incredibly rewarding, and clients are just absolutely thankful. So now I'm going to just sort of frisk through some literature. There's only a handful of papers since about 2008 on veterinary telehealth. So here's a paper, 2018 rather. Here's a paper that looked at, they took dogs that were neutered and did the post-op recheck, comparing video conference and in-clinic sessions, and they found that the owners had no qualms about the telemedicine part of it. The dogs seemed more comfortable. Their 82% seemed more comfortable. 94% of clients agreed they would use it again. If they had the option of doing telemedicine for other things, they would do it. And so this was a small paper. I think it was just like maybe 10 or 12 dogs, something like that. But this was a paper just showing that at least for surgical rechecks, already a BCPR has been established. It's a recheck on a pretty routine surgery with not a lot of post-operative recovery, but clients seem to respond well to it. This is a paper that looked at the impact of telemedicine on the BCPR, and so they were trying to compare the traditional veterinary medicine to telemedicine. So it was basically a demographic study that you can look into. The most common reason why owners didn't follow up with their family vet was because of finances, and we find that as well to telemedicine. They'll come on to VetTriage because they don't have the finances to go see a veterinarian, and so they'll try and figure out what kind of advice can you give me so I can be safe about this. And keep in mind too, folks, like we all know clients go on Facebook and on Instagram and they message people veterinary questions all the time. This advice is being given all the time without any regulation. At least with companies that are out there now, both the text, email, phone call, and video ones like VetTriage, at least you're having a veterinarian that's overseeing this advice, because advice is being given 24/7. I mean, it's nonstop online. We all know this. We all see it. Here's another paper showing basically the outcome of this paper was showing that veterinarians really don't know what telehealth and telemedicine is. They don't know what the definitions are. And with the pandemic, that's improved a little bit, but still, veterinarians are still confused as far as what this means. So hopefully this lecture helped bring out some ideas. Here's an example. This is Dr. Nicole Bruno. This is one of my colleagues, and she's showing how a pet owner can look at the gums for a pet. So it was very nice of her to contribute to this. So when you look at the general information, general knowledge base for veterinarians, this paper had a lot of information in it, and so there's the paper if you want to look into it more. But in trying to define telehealth and telemedicine, look at these categories. Look at these 6 different categories of what it may mean to a veterinarian. 11.8% label telehealth as being the same thing as telemedicine. So there's an education gap, and it starts with that. First, we all learn what telemedicine is, and then we say, okay, what can it be used for? And then how can we expand on that? And we're trying to spearhead this movement. Again, what do you think of? What keywords come to mind when you think of telehealth, telemedicine? I mean, again, these are just all over the place. Where veterinarians are putting their thought process when it comes to veterinary telemedicine, telehealth, how you define them. And again, 8% think it's the same as telehealth when you define it. Concern and uncertainty, 9 to 13%. So we've got a lot of growing up to do when it comes to veterinary telehealth for sure. Here was a cool paper looking at actually gait analysis and using just video. So this was kind of cool. They found that inter and intra observer agreement was high when you looked at lameness numerical rating and visual analog scores. So when you compare the numerical rating and visual analog between different people and within the same veterinarian who reassesses the dog on video, there's high agreement, which is nice to know. So you can perform gait analysis with video capabilities. And so finally, just to kind of recap here, we have future goals. We have created a Veterinary Telemedicine Association. And so in order to be able to lobby, change these current regulations, we hope that through this association, we can actually start the process, to start the conversation, to get things changing in the right direction. And I do believe wholeheartedly that changing the current statutes for telehealth in the veterinary field is going to turn right back and actually improve our culture overall. Less burnout, less fatigue, better quality of life professionally speaking, more hiring, more versatile veterinary careers. If now you're on maternity leave or paternity leave, or you're out with a disability, you can now perform telemedicine that way. We want to make sure that we can allow veterinarians the avenues to do that. We're going to be publishing data. We're planning using our first 1,500 cases to publish data. It'll be the largest telemedicine paper ever in the veterinary space. And we're hoping to lay the groundwork in showing that veterinary telemedicine can be performed in a safe manner within ethical and legal boundaries. So lobbying efforts I already mentioned. I'm now the Chief Medical Officer at Hearts Alive Rescue Animal Clinic. We are implementing VetTriage into the clinic to try and figure out in demographics that have financial hardships, how can we use telemedicine to grant them veterinary care by using a company like ours. We're all over the media. We've got a ton of blogs and articles out there. I've done radio stations. We've done medical articles. We've done kind of leisurely articles. It's insane. It's blowing up, and it's becoming more and more frequent now. Folks are realizing not just telemedicine is a thing since the pandemic on the human side, but that it's a huge thing with the veterinary. And most folks out there who are unfamiliar with the laws can't believe that we can't prescribe medications, that we actually can't have rechecks. We can't have routine telemedicine sessions without a VCPR, because on the human side, you can. So we're looking to expand VetTriage. We want to see an avenue where it's all exotics. We want to see large animal only, production animal only. We want to see specialists only to perform telemedicine with no VCPR within guidelines to the pet community. Give access to folks who don't have veterinary care otherwise. I'll tell you actually a crazy story, and then we'll finish up here. There's a town in Alaska called Bethel. They have a veterinarian that flies in 1 week a month. That veterinarian is there for the week, takes care of all the pets in Bethel, flies back out. The other 3 weeks, there's no veterinarian. The next veterinary hospital is over the mountain range to the capital. So I've had GDVs call me from Bethel. The veterinarian won't be in for 3 more weeks. What do I do? There are plenty of examples like this of areas that are just remote. They have no access to veterinary care. None. And I think that we have a role to play as veterinarians. If our goal is truly to save as many lives as possible, I think we can do it with veterinary telemedicine. There's rescue organizations that are starving for this type of service. There are folks out there that can't transport their horse to the nearest hospital because the nearest hospital is 8 hours away, or the veterinarian has to fly in to see their pet. Folks are immunocompromised. They can't leave their house because of COVID. There's a slew of reasons why clients can use a company like ours, and I think that we need to update these antiquated laws. So to summarize here, the laws I feel are antiquated. We need to establish gold standards. I want you guys as doctors to recognize different types of telehealth. There's good and bad to all of them, the 3 categories. I want telehealth to be the 4th pillar of veterinary telemedicine, of veterinary medicine. You have to select what fits your goals best. If you want to have the software to perform your own telemedicine, go for it. If you want to set up a texting telemedicine service or chat or email, whatever it is, sure. If you want to provide the services that Triage provides, after hours answering service, overflow, if you're getting swamped in the daytime and there's too many walk-ins, you have us. You can always contact me for more information on VetTriage. I would love any other ideas on lobbying efforts, on more lecturing, on mentoring. We want to change the culture of veterinary medicine. That's a whole different lecture on its own. I believe that we can really tie this all together if we're able to give veterinarians a better quality of life by using a company like ours to outsource the high number of cases that we're seeing. We're seeing too much burnout with this profession. There's a lot of the suicide rates are going up. We have so much work to do. And I think organizations like yours is a huge step forward, Get more diversity in there, get more ideas, get more blood in there, because it's been too long. And in my opinion, we're behind on this. So I hope this answers all of your questions regarding veterinary telehealth. And I understand, of course, I place a lot of emphasis on my own opinions as a televeterinarian over the past 9 months. I feel very strongly about these things, and I believe that we can move in the right direction. I believe that we still need to grow, not just in telemedicine, but also as veterinary medicine as a culture. So I welcome, if anybody wants to at this time, any questions or comments or ideas. And I thank you for your time.
Thank you so much. This was so informative. As I put into the chat, there's still so much uncharted territory in regards to telemedicine. In each state has such different opinions or no opinion on telemedicine. I think COVID, as you mentioned, just kind of like put the light bulb in. Although the telemedicine conversation, if you follow any of the veterinary literature magazines that are available, it's been a topic for some time now, for some years actually. I think COVID just put it more in the front of our brains versus just in the back of our brains. And some clinics really had to like resort to using telemedicine because of the practice situations in their state. In the state in which I practice, we were considered essential, so therefore we were able to continue to practice. But in some states, it was very limited on the things that they could do. So I think telemedicine does have a place in veterinary medicine, and I think as more research comes out, as more people become comfortable with the concept of seeing patients in a non-traditional way, and I think curbside service, most of us are pretty much tele-advising, right? We're over the telephone and things like that when clients not coming into the exam room. But I think with the curbside services and the phone calls and the FaceTiming and things that we've been forced to do, I think more clinicians are going to feel more comfortable with it, whether they decide to do it on their own or to enlist a service like VetTriage to handle those situations for them. Thank you so much. This was so informative. You get those calls all the time. Well, something's wrong with my animal, and they need to come in, and the receptionists are like, well, I can't tell you that. I'm not a doctor, But for those instances where someone may not be able to come in, and it may not be a financial situation, it could just be the lack of transportation. As you mentioned, like a horse, or living so far away, or you just don't have a vehicle, right? Or you can't walk to where the veterinarian is. Telemedicine will definitely, I think, hold a place in that capacity. So on behalf of NABV, we thank you so much for taking your time to present this to us, this very hot topic, something that we're going to be talking about for a long time. And I think as we move along, we're going to see more legislation in the states having to make a decision on how they're going to handle telemedicine, because it's not going anywhere at all.
Absolutely.
So thank you so much.
Oh, you're very welcome. You know, it's interesting because even with the transit point that you had mentioned, we've had a call. I've had to call pet ambulances to get to people's houses because they can't leave the house. You know, when the riots were happening in Chicago, there was actually a sick bird, and the clients didn't want to leave. They were afraid of getting pulled over by the cops because there was by the police because it was a curfew, and so we actually called an ambulance service for them to send them over there to grab the bird and bring it to the hospital because they didn't want to leave their house for their own safety and they didn't want to get pulled over by the police. So there's just so many different ways that telemedicine can be used. And thank you very much for your time. And it's warm. It feels very good to know that veterinarians are open to adopting a different way of looking at these things. And I hope that those powers that be will also jump on board. We truly believe that we're spearheading a movement.
Yes, yes. You know, veterinary medicine, and we can go on forever. Although it's progressed, still antiquated in so many ways. And COVID has proven that to us. And so, you know, and other things, but definitely, I think that with time and that telemedicine, and I said once the states start to speak up with legislation in regard to how we function with telemedicine, especially even with the human component with COVID too, I think in the very near future we're going to see more accessibility in more states allowing practitioners to you know, participate in telemedicine.
Absolutely. Thank you so much.
You're welcome. Good night. Thank you.
Good night. Thank you, everybody. Bye-bye.
Bye-bye.
Bye.
Bye.